Congratulations on getting a tennis elbow. Good job. Tennis elbow is the most common overuse syndrome in the elbow. The symptoms are often described as pain on the bony part on the side of your elbow, pain when turning, lifting, pinching, pain can radiate upwards and along the arm, pain when starting activities but might subside during but comes back the day after. Expected recovery varies, but usually around 4 months to 1 year, depending on severity. Because tennis elbow is mainly caused by overloading your elbow, the primary goal of its rehabilitation is to reduce the total amount of load placed on your elbow to either at or below your capacity level. This is essential so that your elbow can tolerate the demands placed on it during different activities and tasks in the daily life. In the early stages, the aim is to relieve pain by reducing the load on the tendon. To do this, you want to avoid provocative activities. Pat a tendon is painful, switch arms temporarily. You can also try to stretch your forearm muscle to release some pain, if that feels good for you. Once the pain has subsided, you want to gradually build up your strength and capacity. The exercises will fall into 2 different categories. The first category of exercises focuses on the forearm muscles. If you don't have any weights at home, you can use various objects such as hammers, resistance band, water bottles, etc. For the wrist extension, you want to start with slow eccentrics, then progress into normal wrist extension with increasing speed and weight once you're comfortable with that. The focus on grip strength is also important for your recovery. And here again there are various objects you can use. The second category of exercises focuses on developing the muscles around the shoulder. It is important to have adequate shoulder strength and mobility if you play a sport that requires a lot of shoulder movement and strength. Research also highlights the importance of training these muscles in people with tennis elbow. For the rest of your rehabilitation, you'll want to continue doing these exercises to prepare for the activities and tasks you want to do, but you can alternate exercise that focus on the same muscle group for some variation. When it comes to returning to your sport, you want to gradually go back. Just like with everything else, you want to start with low intensity and frequency, and from there gradually build up once you feel comfortable. So don't jump straight back into a 90-minute game, I beg you. This is an example of a training week in the early stages, and this is for the later stages of the rehabilitation.